While many are trying to look beyond COVID and mandates that still exist, there are still efforts being made to try to get people who haven't been vaccinated at this point, particularly one age group who wouldn't otherwise be coming back here this week, except Grenoble Public School here happens to have a vaccination clinic going on inside right now.
It's March break, kids are out, families are out, and we are absolutely everywhere they are.
Enjoying the day, taking part in activities aside from school will be the highlight of March break for many students. Going to get a COVID vaccine isn't likely something they're looking forward to. And yet, the City of Toronto and healthcare organizers are continuing the push for people to get their shots.
We don't stop fighting infectious diseases, ever. And so the fact that we've entered a new phase with COVID doesn't mean that we accept simply living with the negative effects of COVID.
The city claims more than 70 local clinics are taking place during March break where residents can better access them. Storefronts have been set up in malls. They can be found in shops along the main streets and churches in different neighborhoods.
I just have like a week off, so going to a walk-in, just take advantage of it. Yeah, finally get it done.
While youth vaccination rates have been good, just 57% of kids aged 5 to 11 years old have a first dose, and only 37% have their second. We're still seeing that young children still aren't necessarily getting their shots. Is that why there's an emphasis on it?
Well, listen, when it comes to our Team Toronto efforts to reach everyone, everywhere, we don't stop. Whether it's in school, in the TTC stations, in your local apartment building, we're not stopping.
However, clinics are rotating through different locations at different times and may be difficult to find despite efforts to keep people informed. Those include the Vaccine Read clinics at Toronto libraries. At least 2 were open in Scarborough today, with very few people showing up to take advantage.
We may be all tired of COVID, but COVID's not done with us, and that's why vaccinations are such a critical role that we will continue to accelerate and play.
2 weeks ago, Toronto Public Health did redeploy staff from the city's 5 mass immunization clinics into mobile clinics. On another note, Toronto's Medical Officer of Health, Dr. Eileen Davila, today joined public health leaders from a number of different countries by signing a letter calling on G20 nations to take action on vaccine equity across the world. As of last month, just 10% of the population in low-income countries have received 1 dose of a COVID vaccine.